My name's Raj Bajwa. I'm a GP. I've been a GP for about 15 years.
I'm Hayley, I'm a psychiatric nurse and I work at the Warneford Hospital here in Oxford.
My name's Adele Clare and I'm a research midwife.
I spend most of my time working at the practice, looking after my patients, but I also spend some time in the week working for our local CCG, which is Chiltern CCG, and I'm the clinical lead for medicines management, long-term conditions and end-of-life care, and that's a really, really interesting job. One of the reasons I wanted to do the course is because there will be benefits not only for my work as a GP, but when we're trying to improve health services for our population, to try and learn some of the skills and apply them to a population is something that has great potential, and I don't have those skills at the moment, and I don't think the organisation has them either.
I was a nurse for 4 or 5 years, and then I became a midwife, and I've been a midwife for 15 years. So I've worked on the ground floor and I've delivered lots of babies. So now I'm at the stage of my career I want to implement the research and develop the maternity department.
Initially I worked on an inpatient unit, looking after people with a variety of mental health problems, and I really enjoyed that. I found that I was drawn to working with people with depression, and now I work within a clinic that treats people with treatment-resistant depression. What I'm hoping to achieve from doing the course is to have a better understanding of the research that I look at and appraise and put into practice, and so I know what I'm looking at is good, and that it's reliable and it's valid, and that I should be using it.
And suppose for whatever reason, she's an expert in the field, she thinks it's a 5 centimetre difference.
This is the second day of our first week. We've had a statistics module this morning and some critical appraisal this afternoon, and it's been intense. The teaching team are lovely, and they've answered all my really silly questions and explained things to me in coffee breaks and things when I haven't understood it, and they've been really supportive.
This is a very high quality programme. It provides the participants with the opportunity to take modules, which is excellent in terms of supporting them in their workplace, and they take the learning back to the workplace.
I think what we're looking to do with this course is build a real capacity, build a cohort of people who will take forward a theme of looking to base care on evidence and looking to take any improvement and implement it successfully.
Here's Francis, who's our doctor, who's going to come and speak to you now and explain it all.
The last year on the AHSN fellowship has been wonderful, I can say. It's been lots of sacrifice, hard work, but it's been mind and eye-opening as well. The hopes I had at the beginning have turned into realities, I can say. I feel much more empowered in terms of identifying the best research in my clinical environments and in critiquing the same research. And I also feel much more useful to the day-to-day practice with the teams that I work with.
I've now done all of the 6 modules, just got a couple of assignments to complete. I'm now going into my dissertation period, really enjoying working with my supervisor. She's really dynamic and she's introduced me to loads of different people who have been brilliant for giving me ideas of things to do. I think it's one of the best things I've ever done.
Having Rob involved in this course is essential because he's learning the skills to be able to actually apply not only the existing evidence but also help us develop evidence protocols for the future.
First year's been really interesting. It's been lots of hard work, but the work we've done is built up on the assignment, so by the time you get to do it, you've kind of done the work in the weeks leading up to it. And I think that this knowledge has left me more empowered. I feel more confident to challenge and that I'm right in my challenges.
I can understand sometimes that managers find it perhaps difficult to commit because it is both a time commitment and also a supervisory commitment. But actually the benefits are significant for the organisation, your department, but also for the individual who ultimately returns enthused and with new capabilities, and I would recommend it thoroughly.
This programme has the patient as its focus, and it represents real value for money, both in terms of efficiency and improving patient outcomes at the end of the day.
One of the things I'm hoping for is that being on the course will make me question all of the things that I've always done. And I will share that with patients and explain to them that I may be doing things in a slightly different way because of something I've read, or because perhaps there is a different way of doing it. And I think if you share that with your patients, they value it because they think they're dealing with a thinking clinician and someone who doesn't automatically assume that they know everything and they've got nothing else to learn. For those organisations that have got the opportunity to fund a course like this, I think unless they start investing in healthcare professionals who innovate and drive best evidence-based practice, then they're going to struggle to cope with their healthcare needs within the resources they've got available. I would suggest that it isn't an option for them, but it's an imperative.